The man who diagnosed a gap and built a solution. In a country where healthcare can feel like a lottery rather than a system, Tani Fafunwa spotted something others merely endured, a glaring gap in reliable, high-quality diagnostics. Instead of complaining, he built. And in doing so, he helped turn Afriglobal Medicare Limited into one of Nigeria's most credible, globally benchmarked diagnostic brands. This is not just a story about medicine. It is a story about precision, ambition, and the quiet power of systems done right. Series Introduction. It's Monday the 23rd of March 2026. Welcome to the 123rd edition of The Entrepreneur. In this series we take a deep dive into the life and entrepreneurial journey of Tani Fafunwa, the healthcare strategist who has taken Afriglobal Medicare Limited to another level. If you are visiting us for the first time, please subscribe, smash the like button, share this video and help us grow our family. If you have already subscribed, then show your support by liking the video and making a comment. Now let's jump right back in. From boardroom brains to bedside impact. Before healthcare, Fafunwa was already sharpening his entrepreneurial teeth. With over 2 decades of leadership across startups and growth stage businesses, and an MBA from Stanford, he had seen what excellence looked like globally. He wasn't a conventional doctor founder. Instead, he was something arguably rarer in African healthcare, a systems thinker. He understood that healthcare outcomes don't just depend on clinicians, they depend on infrastructure, processes, and standards. His earlier success transforming businesses, such as scaling Resourcei into a public company delivering a 4x investor return, gave him a playbook: build teams, enforce discipline, scale with intent. When he turned his attention to diagnostics, he wasn't starting from scratch, he was applying a proven blueprint to a broken system. The big bet: diagnostics, not drama. Most healthcare entrepreneurs gravitate towards the obvious prize: hospitals. They are visible, prestigious, and emotionally compelling. But they are also capital-intensive, operationally complex, and notoriously difficult to scale without compromising quality. Tani Fafunwa looked at that landscape and made a contrarian call, one that would define the trajectory of Afriglobal Medicare Limited. He chose diagnostics. At first glance, it may seem like the quieter corner of healthcare. No operating theaters, no dramatic emergency rooms, no cinematic moments. But beneath that calm lies the most decisive layer of modern medicine. Diagnostics is where certainty begins. It is the difference between guesswork and precision, between treatment and mistreatment. Fafunwa recognized the critical truth: every clinical decision is only as good as the diagnosis that informs it. The hidden backbone of healthcare. In many emerging markets, including Nigeria, diagnostic services have historically been fragmented, inconsistent, and, at times, unreliable. Results can vary from lab to lab. Turnaround times can be slow. Quality assurance is often uneven. That creates a dangerous ripple effect. Misdiagnosis leads to incorrect treatment. Delays worsen patient outcomes. Clinicians are forced to make decisions with incomplete or questionable data. Rather than compete in the crowded space of treatment, Fafunwa focused on fixing the foundation. Afriglobal Medicare was built to be that foundation, a dependable, standardized, high-quality diagnostic engine that clinicians and patients alike could trust. Precision over prestige. Choosing diagnostics over hospitals wasn't just strategic, it was philosophical. Hospitals often reward visibility. Diagnostics rewards accuracy. And accuracy demands discipline. Rigorous lab protocols. Highly trained technicians. Calibrated, well-maintained equipment. Relentless quality control. This is not a business you can win. It is a business you must engineer. Fafunwa leaned into this reality. Afriglobal was designed not as a loose collection of labs, but as a tightly run system where processes matter as much as people. Every test, every sample, every result flows through a chain of accountability. The scalability advantage. Here's where the bet becomes even more interesting. Diagnostics, unlike hospitals, can scale elegantly. Instead of replicating full-service facilities across multiple locations, Afriglobal adopted a hub-and-spoke model. Central, highly sophisticated laboratories, the hubs. Smaller collection centers and partner clinics, the spokes. This approach delivers several advantages. Consistency, tests are processed in controlled, standardized environments. Efficiency, expensive equipment is centralized rather than duplicated. Reach, patients can access services from multiple touchpoints without sacrificing quality. In essence, Fafunwa built a system where scale does not dilute quality, it reinforces it. Speed is a clinical advantage. In diagnostics, time is not just money, it is health. Delayed results can mean delayed treatment. In some cases, that delay can be life-threatening. Afriglobal's model prioritized fast turnaround times without compromising accuracy. This required more than just technology, it required operational choreography. Streamlined sample logistics. Digitized workflows. Coordinated lab processes. Speed, in this context, becomes a competitive advantage and a clinical differentiator. Trust as a product. Perhaps the most powerful insight behind this big bet is this: in diagnostics, the real product is trust. Patients rarely understand the technical details of a lab test. What they care about is simple. Is this result correct? Clinicians depend on that same assurance to make critical decisions. By focusing on quality standards, international benchmarking, and consistency, Afriglobal turned trust into a tangible, scalable asset. A quiet revolution. There is nothing flashy about building diagnostic infrastructure. It does not trend on social media. It does not make headlines in the way hospital launches do. But it is transformative. By choosing diagnostics, Tani Fafunwa didn't just start a business, he strengthened the entire healthcare value chain. He made it possible for better decisions to be made, faster and more reliably. And that is the quiet brilliance of the bet. When you fix diagnosis, you improve everything that follows. Building a brand that thinks global, acts local. Here's where things get interesting. Afriglobal didn't aim to be good for Nigeria. It aimed to be good, full stop, by global standards. From the outset, the company focused on structured operations, best practice systems, international benchmarking. Fafunwa himself articulated the founding philosophy clearly: build labs around globally recognized systems and ensure the highest quality standards. That ambition paid off. In 2022, Afriglobal achieved ISO 15189 certification, one of the most rigorous global standards for medical laboratories. This wasn't just a badge. It was a signal. We are not playing locally, we are competing globally. Scaling with substance, not noise. In an era where startups chase hype, Afriglobal chose something unfashionable: operational excellence. Under Fafunwa's leadership, the company grew revenue by over 80%, reduced staff attrition significantly, improved patient satisfaction by over 30%. These are not vanity metrics, they are the hallmarks of a business that works. Behind the scenes, Afriglobal also adopted innovative models like centralized laboratory systems, allowing multiple clinics to plug into a high-quality diagnostic hub. Translation: scale without chaos. The quiet power of values. Afriglobal's rise isn't just technical, it's cultural. At its core is a simple but radical idea: patient care comes first. This shows up in faster turnaround times, reliable results, customer-centric service. In markets where trust in healthcare can be fragile, consistency becomes a competitive advantage. And Fafunwa understood that early. Lessons for young healthcare entrepreneurs. 1. Solve the unsexy problems. Everyone wants to build the next flashy hospital. Few want to fix diagnostics. Yet that's where the leverage lies. 2. Systems beat heroics. Great healthcare is not about individual brilliance, it's about repeatable, reliable systems. 3. Think global from day one. Don't aim to be good for your environment. Aim to meet global standards, even if you're starting in a local market. 4. Build teams, not empires. Fafunwa's success is rooted in building high-performance teams, not lone wolf leadership. 5. Measure what matters. Revenue, staff retention, patient satisfaction. Track real indicators of health, business and clinical alike. 6. Trust is the ultimate currency. In healthcare, brand equals trust. And trust is earned through consistency, not marketing. Final diagnosis, precision wins. Tani Fafunwa's journey is a powerful reminder that transformation in African healthcare won't come from noise, it will come from precision, discipline, and systems thinking. By choosing diagnostics, insisting on global standards, and executing relentlessly, he has helped position Afriglobal Medicare as a credible, internationally aligned healthcare brand. For the next generation of healthcare entrepreneurs, the message is clear. You don't need to reinvent medicine. You need to make it work, properly, consistently, and at scale. If you would like to know more, or wish to discuss brand sponsorship of any of our videos on entrepreneurship, please get in touch on any of the social media handles below. All our content is developed from real-life experiences in a professional and entrepreneurial journey that spans across 8 countries and 4 decades. Quote of the week. Perfection is not attainable, but if we chase perfection we can catch excellence. Vince Lombardi.